Welcome back to the Navigate Maternity podcast. Today, we're going to talk about something a little bit heavier. I don't trust the healthcare system, and I'm not alone. Let's get into it. Oof. Yeah, this one's going to be one.
We're going to take a breath first.
Yeah, we're going to take a breath first. So, I think we would be remiss to not talk about how women, Black women especially, have not been able to trust the healthcare system. Like how over the years, healthcare as an entity has treated us, and how it has just bred this mistrust between patient and clinician, and patient and hospital, and patient and another stakeholder, nurse. Like there is this divide where often women don't feel heard, we don't feel seen, we don't feel like you have our best interests at heart, and for good reason.
Mm-hmm.
So let's talk about the history a little bit. Why do we feel this way?
So I think at the forefront, we can look at the statistics that currently exist, right? Where it's no secret that Black women are disproportionately affected by healthcare disparities, which results in us dying 3 to 4 times our majority counterparts. And then when you correct for women who are educated, when you correct for women of a higher social economic status, considering that Black women are currently the most educated demographic in America,
Story.
it still does not excuse us from having worse outcomes. Me, as a Black woman with an MD and an MBA, am more likely to die from complications of childbirth in comparison to a 15-year-old white collar, like high school dropout.
Mm-hmm.
And that's just a fact, right?
Yeah, those are, yeah.
So we look at the outcome, which is the present, but I mean, we can take it back to the beginning.
Right.
So for me, I grew up in Fort Wayne, Indiana, went to private Lutheran schools, did not really have any Black history that was taught to me outside of what my parents taught me at home.
Right.
Then went to a majority high school that was also private, and then went to a PWI
Right.
for college. And got to medical school. And again, I am one of few,
Right.
of people that looks like me in this institution. And it wasn't until I was a resident that I learned the ugly history of my craft, meaning the founder of what we call the father of gynecology, who wrote the textbooks, who perfected the surgical technique. Where do you think he got that knowledge from?
Right.
It was from practicing on enslaved women.
Okay.
So Dr. Sims, there are retractors named after him. And when I think about the Sims retractor, which is a star that has hooks at the end of the star that you clip into the patient's skin circumferentially to make a star. So that gives you greater exposure of the vagina as you are doing surgery on the vagina. I always thought it looked like a device of torture.
Right.
And I'm using that on an anesthetized patient that's sleeping, that's not feeling any of it.
Right.
But then when I think about the fact that it was developed on women who could very much feel what was going on.
Right.
And
They
they
were
were
like
given no
anesthesia.
choice.
Right.
They were given no choice. They were simply tortured.
Yeah.
And that's where these devices were developed. So this happened back in the 1800s, right?
Right.
And that has just continued in a systemic way,
Right.
in a personal way.
Yeah.
And thus results in outcomes we currently feel.
Absolutely. I mean, there's another case. Obviously, we could talk about Henrietta Lacks, right, and the use of her cells, the HeLa cells that are still used today. We could talk about the Black women that were sterilized down south. And I think this was happening, in the 60s and 70s, right? These were Black women who were
Absolutely.
sterilized against their knowledge.
And I think that it's also important to know that we'll talk to this too about how it's important, so important that you select a healthcare professional that um, is knowledgeable, that is relatable, that can anticipate your fears and communicate
Yep.
to reassure you.
Yeah.
Every single time I consent a patient for a sterilization procedure, there if they have Medicaid or a managed Medicaid payer,
Yeah.
you have to fill out a Medicaid sterilization consent
Mm.
more than a month prior to the procedure
Okay.
occurring. And there's some loopholes to that in that if this is a very unexpected or premature delivery, then it's 72 hours beforehand.
Right.
But sometimes patients will say, this seems obstructive, like because I have Medicaid, I'm discriminated against, that I have to fill this form out more than a month before. But somebody who has private insurance can say during their C-section, hey, I want my tubes taken out,
Right.
and they can have that, but I can't have that. And I always emphasize, whether they bring that point up or not, that this sterilization consent is a protection for you.
Right.
Because previously, the ugly history is that patients that had Medicaid were sterilized against their will and without their knowledge.
Right.
And so this form was put into place by the government so that if the doctor did not sign it with the patient and date it more than a month before the procedure, they are not compensated for the entirety of the patient's hospitalization.
Oh, right. So basically,
So-
you're hitting them pockets.
Exactly.
Them pockets to make. But think about, just take a moment for that. Think about how that in order to get people to stop doing that, I gotta hit your pockets.
Right, because they were sterilizing
Yeah.
people without their knowledge. One, for their own racial bias of, I don't think this person should be reproducing in society, but they were also compensated for it.
Right. Exactly. Yeah.
You're billing it as a procedure and you're getting paid for it.
Right. Right.
And so it's a systemic barrier that is, it's recognized that this happened,
Right.
right? And so this is put in place to protect patients, but I think it truly is an example of the ugly face of medicine, but most people have no idea
Right.
why this even exists, because it's not taught.
Exactly. And there's something that you also hit on too, is about, hey, you want to find a provider that's listening to you, that is knowledgeable, that you can feel safe with. As a resource, Health in Her Hue. We'll link that below too. Great resource for women looking for a culturally competent provider, founded by Ashley Wisdom. Please go check it out as a resource. Cause yeah, and that's exactly what they do, is help to connect, women with providers that are going to listen to them,
Absolutely.
which is super key. So let's talk about what's happening now. I mean, I just think, like, right now is so. I'm gonna bring up my phone because I was reading the article. Adriana Smith. Let's talk about her. 30-year-old Black nurse in Georgia, has been on life support now. Is currently still on life support. Went on when she was 9 weeks pregnant, and
So first
is brain
trimester.
dead. Yeah, and she is brain dead, and they won't take her off. Like,
I feel like there's so many layers to this. First of all, she's a healthcare professional
right.
who was experiencing a worst headache of her life, who went to the ER in her community where she works,
Right.
right?
Yeah.
And was dismissed, was sent home without the proper imaging to truly evaluate the underlying cause of the worst headache of her life, right?
Right. That's just,
And the results of that is she is now brain dead because she had a stroke.
right.
right? So, firstly, you have that implicit bias, which led to a worse outcome because she shouldn't be brain dead in the first place.
Right. Dismissed, just completely like dismissed.
And even her own education
Right.
and knowledge in being going to a hospital in a community where she works,
I'm about to
she
say,
would have
yeah.
a rapport and be taken seriously. That still didn't happen,
Mm-hmm.
right?
Yeah.
And then you got the systemic issue that she's in Georgia.
Right.
And Georgia has a very firm abortion ban.
Yeah, it's called Georgia's Life Act. So it's a law, according to Yahoo News, it's a law banning most abortions after roughly 6 weeks of pregnancy once fetal cardiac activity can be detected, aka Georgia's heartbeat law.
Right. So it's like here you take away her bodily autonomy. Like at 9 weeks gestation, which I also got to bring this up. The media keeps showing her maternity pictures from her
Last pregnancy,
pregnancy.
exactly. Yeah, no.
Sensationalize it to make it look like she's in the third trimester.
They're trying to save the baby. They're trying to, yeah. And it's like
Yes.
that's not what's happening. She was 9 weeks when this took place. And essentially now they've kept her on life support. I think the goal is to keep her on there until she's 32 weeks, but she's only like 22 weeks now.
Right.
So, I mean, this is saying that we're gonna keep this woman and this infant on life support, but she can't move. She can't walk. The baby has what's the condition called again that the baby has?
Hydrocephalus, which is just a lot of fluid within the ventricles of the brain, which can compress the actual brain matter, which we call the parenchyma, which will result in, developmental delays all the way to profound neurological issues
Right.
that will impact that baby. And then, she had a anoxic brain injury herself. That's why she's brain dead, right?
Right.
So a 9-week fetus,
Yeah.
like, what is this child's life gonna be like?
Right. Right.
Will this child even survive? And if it does survive, her family is left
Yeah.
with this daily reminder without choice and being forced to care for this child.
Yes. Yeah.
And I think it's truly heartbreaking all around where there's so many layers to this of like how the government and politics impacts your individual life and health
Right.
to the racial bias that led to her being brain dead in the first place.
Absolutely. Yeah.
And how even though, you know, she's educated, she works in healthcare, it still didn't prevent this outcome.
Right.
So I do want to highlight a little bit of a silver lining. And let's talk about, with our perspective and with our knowledge, how did we engineer Navigate Maternity to truly address these issues?
Oh yeah. I mean, this is so these kind of instances are exactly what we seek to help prevent
Exactly.
from happening, right? So when, you know, again, when she's having the worst headache of her life, she's able to notify her clinician right away so we can have an intervention. And then that's backed by the data that pulses through our app, through our platform back to her doctor who's been responsible for her care. And instead of it going dismissed and moms just going home and not like and unfortunately having these situations where mothers either die or they have some severe morbidity, some severe stroke, severe hemorrhage, we're capturing it before we ever get there.
Absolutely.
We're intervening before we ever get there. And the other piece of this too is often when we think about like solutions that are out there, we wanted to create a solution that wasn't just something that we kind of cooked up in the kitchen, right? Or it wasn't something that we just kind of cooked up with between just you, I, and Thea and in our core group. It was we actually went out and did the research. We did the R&D. We spoke and had mothers who looked like us, who didn't look like us, who had other challenges. Maybe they were rural moms, but to identify what were the core things that they were facing so that we can actually build a solution customized for you. And I think that makes a big difference when you're building solutions that you actually are inclusive and you include the women that you're looking to serve. I think that's how you create an impactful solution. And not just the women. I mean, we talk to payers, health systems. We talk to every stakeholder that we could think of that would be part of this so that we understood the pain points and we could help solve the actual problems, not just glossing, not just putting something on there to, you know, to just do it, but to
Right.
do something that was really going to make an impact. And I think that's what Navigate does. Like, we help to prevent these kind of catastrophic issues. And you could look at our research, you could look at the data, you could look at the outcomes for moms who've used us. We're saving lives. And when I see a mom like this, it's heartbreaking because potentially, it could have been prevented.
Absolutely. We know that more than 80% of maternal deaths
Yes,
are from preventable causes.
84%.
And so I think what's important is that we realize as a health equity company that although all women will benefit from Navigate Maternity, Black women have the most to gain from health equity.
Absolutely.
And that's the core of our mission. It's the core of our vision. And yes, I'm an OBGYN. Yes, I take care of women. I do the best thing that I can, the best that I can every day. But at the same time, I can't take care of every woman in America.
Right. And we always say, I literally, when we started the company, what I used to always say, I'm like, how can we scale Dr. Harris's brain? How can we literally be able to make a version of her so that every clinician has access to how they should best treat their patients? Because I know the kind of care that you give your patients. You can look at the outcomes that your patients have. You have excellent outcomes because you would give excellent care. How can we make sure that every OB, every system, every certified nurse midwife, every nurse practitioner can give that kind of care? How can we support them
How
to
can
give
we
that?
scale it on a systemic level?
Exactly.
And so I think one other thing that I always say to you, the gray area is the implicit bias.
Oh, yeah.
And how do you get around implicit bias? You replace the subjectivity with objective data. And that is what Navigate provides. Community, the data that can't be argued with,
Yeah.
the support, and the safety net
Yeah.
of the alerts, the connectivity to the healthcare system, our patient navigators that act as advocates for, or I should say, advocates for our patients, and a complete suite of wraparound services that supports mom throughout the entire journey, from diagnosis of pregnancy to the year postpartum.
Yeah.
And so I think that it's so important that we continue just to spread the word, because the data's out there. Everybody hears the data. Everyone has the fear. Even our own friends thought it was
Oh, yeah.
painful to watch our video that we put
Oh
out
my
last
goodness.
year.
Yeah.
Like
Oh,
real tears.
let's talk about that really quickly. So
And I think we need to link it
yeah, we
for
do.
the reference.
Yeah, we'll definitely link it below. So we did a video, I guess it was last year or 2 years
Was
ago
it
almost.
2 years ago? Time flies.
Maybe it was last year. And so, but it was a video where we brought in, we were like, well, hey, we want to do this kind of set around these moms and their experiences, all their birthing stories. And we were like, oh, I don't know if we could pull it off. We were thinking maybe we have a few moms. We ended up just calling around and we quickly got 20 moms who had catastrophic events during their pregnancy. It was like eye-opening and slightly sickening that all these women had almost near-death misses with their pregnancies, like all of us. It was like not a single one of us didn't almost die during pregnancy, mostly from seemingly preventable things.
Right.
And that was so scary. So we recorded that, and that's what we'll link below if you ever want to go watch it. There's a shorter version. There's also a longer version. It's like 25 minutes. And you can watch that. You can hear these stories. This is not something that we're just, oh, it's happening here and there. Oh, no, it's happening a lot more because what's not being documented are the near misses.
Absolutely.
There's
That's not
plenty
the
of near
recordable
misses.
data.
Exactly. There's plenty of near misses.
Yeah, and I mean, these aren't women that w live in poverty,
No,
right?
these are
Nurses,
college educated, master lawyers, doctors. I'm talking about, but all of us, all of us are Black women. And that should go to tell you there's something happening with this particular patient population that cannot be ignored, period. And something must change about it now, period.
So, as a silver lining to all this negativity and the talk about, these systemic barriers that truly impact our outcomes, I do want to highlight that Navigate Maternity is not just a passion project for us. We truly engineered this to save ourselves because you had
Yeah.
a near tragic outcome. I see it every day. I can't tell you how I've nurses have called me and said, "Dr. Harris, we need you to come over and take over on this patient's care because we feel like they're not being heard and we know you will hear them."
Yeah.
And so I think with our mindset and our background, we engineered something that will truly address the systemic barriers that we have in America to improve the outcomes for everyone, but especially Black women.
Absolutely. And one thing I want to call out is that, to your point, as you and I both know, we are focused, laser focused on solving these outcomes for women. And as we know, because Black women have the most to gain, and because we are Black women, right? Absolutely. I also have to call out rural women. There are rural white women dying every single day,
Absolutely.
and they are not creating solutions with their voice, with their things, and with their needs in mind. And I think that when we built Navigate, that was one of the voices that was important to us. As I would say, vulnerable women.
Mhm,
Vulnerable women, and you'd be shocked who's in that bucket. It's most of us, because women are vulnerable.
mhm.
Let's call a spade a spade. Women in this country are vulnerable. And that's what Navigate seeks to solve. How we can be a solution while women are in this predicament in this country, how we can help them through this process of giving birth and then postpartum. Wrap it up for us, Dr. Harris. Take us home.
So I just want to again emphasize that at Navigate Maternity, we truly care. We provide a solution that engages you in a community that cares about you, that provides you and empowers you with the education and the knowledge to serve as an advocate for yourself, that replaces a subjectivity with objective data so that you feel empowered to know that you are getting the best possible outcome.
I agree. And what I would say, in closing is that we understand why you don't trust the healthcare system. We get it.
Absolutely.
That's why we created Navigate. We get why you wouldn't want to trust it. I mean, we went through the history, went through the fact that, enslaved women were literally tested on how we can go through situation decade by decade, and how Black women have often been the guinea pigs up till today
I was just gonna say, we were experimented on then and we're experimented at
on now.
present time.
Because it's not lost on us that that Black nurse in Georgia is a Black woman. It's not lost on us.
Right.
So I say that to say we understand why. That's why we created Navigate, to help solve for that. And our goal is that over time, you can start to build trust back with your healthcare team. We'll link again those resources. Obviously, always go to navigatematernity.com. I'm going to link Health in Her Hue below. And if there are any other resources that moms know about that maybe we didn't mention in today's show, please link it below. What are some other ways and other communities that we can join or our moms can go to so that they too can get the resources that they need and they can build back that trust with their care team? If you know of something, put it below, share, don't gatekeep. Until next time, thank you.